Hi friends, so in this video we shall be discussing about calcium metabolism and some of its basic applied concepts. So calcium is an abundant cation in human beings. It usually exists in two forms. One is the extracellular and the other is the intracellular. In intracellular form is usually used as your secondary messengers in your various intracellular signaling pathways, and your extracellular is used in your coagulation. It is used in your synaptic transmission. Then it has a role in secretion of other hormones, and it also plays a very important role in excitation, contraction, coupling mechanism, which leads to the contractility of the muscles. Right, the total serum calcium level ranges from 8.5 to 10.5 milligram per deciliter, of which the ionized form is around 4.4 to 5.2 milligram per deciliter, and this is usually the active form. So now let's take a look at the level at the calcium metabolism. So what happens when there is low calcium levels? It is sensed by the calcium sensing receptor, which causes increased secretion of this parathyroid hormone. Now this parathyroid hormone is an 84 amino acid peptide. Now it is cleaved in liver and C terminal peptide. Right, now this is the inactive part, and it is usually cleared by kidneys. Then you have an active part, which is your N terminal, right? And this is basically responsible for your action, all the actions, responsible for all the actions, right? So you need to remember that the parathyroid has main action at three groups. One is the bone, second is the kidney, and third in the intestine. So what happens in the bone? And bone, it acts on both osteoblast and osteoclast. Now as a result of which it causes an increase in your calcium efflux. Right, now in kidney, what it does, it causes an increased calcium reabsorption, and it converts the vitamin D to its active form, which is your 125 dihydroxycholecalciferol. Now this 125 dihydroxycholecalciferol in turn acts on the intestine, causing increased calcium reabsorption and increased phosphate reabsorption. Right, so parathyroid hormone does not act directly on intestine. It rather first acts on the kidney, converting the inactive form of the vitamin D to the active form. Now this is 125 dihydroxycholecalciferol, which in turn acts on intestine, causing increased calcium resorption. The net result of which is your increased calcium levels, right? So this is all about your calcium metabolism. The low levels of calcium causes increase in the parathyroid hormone level, which has an active component, which is the N-terminal peptide. It acts on the bone, on both osteoblast and osteoclast, causing an increased efflux of the calcium ions. In kidney, it causes increased calcium reabsorption, and 125 dihydroxycholecalciferol is formed from the inactive form of the vitamin D, which is secreted by the liver. Now this active form acts on the intestine, causing the increased calcium reabsorption, the net effect of which being the increased calcium levels. Right, so now coming down to the applied concept. So if you have calcium levels, it could be either a hypercalcemia or a hypocalcemia. So let's understand few important points regarding hyper and hypocalcemia. Now first, regarding the value. Now hypercalcemia is usually seen when the values rise more than 10.5 milligram per deciliter, whereas hypocalcemia is usually seen when values fall below 8.5 milligram per deciliter. With the clinical features of a hypercalcemia, the patient might be presenting to you with abdominal pain, anuria, acute confusion, vomiting, or dehydration. Whereas in case of hypocalcemia, they might be having circumoral numbness, digital numbness. So the circumoral area would be numb, right? And then there is a sign which is very important for you guys to remember, as it would be seen in your clinical scenarios, specifically when you are in your post-op rounds after an operation called a thyroidectomy, where thyroid gland is removed, where there are chances of injury to the parathyroid gland. Now this parathyroid gland secretes the parathormone, which is responsible for your entire calcium metabolism, right? So what happens is that if this parathyroid hormone is damaged, then there would be low levels of calcium level. Now in such cases, you might be able to see the following sign. So one is the Schwarzschild sign. So what happens in it is that there's a contraction of the ipsilateral facial muscle on percussion of the facial nerve below the zygoma. And then there's another sign which is known as the Trousseau sign. Now what happens over here is that there's a carpopedal spasm when there is a occlusion of the arm, right? So there's a few important clinical features which will be acting as your clues in your various clinical scenarios. Now, another important thing that you need to remember is regarding your ECG finding. So in case of an hypercalcemia, you would be expected to see a short QT interval, whereas in case of hypocalcemia, it would be a prolonged QT interval. Now, in addition to a short QT interval in hypercalcemia, you would also be able to see a prolongation of PR interval, right? Now, coming down to the treatment part, first for the hypercalcemia. So now you need to cause increased excretion of calcium. So you can use a loop diuretic. Now you also need to cause a reduced skeletal release from the bone. So over here we use a drug called the bisphosphonates, right? And then obviously would be to treat the underlying causes of hypercalcemia and aggressive rehydration therapy in case patients of hypercalcemia. So now what are your causes? So let's understand few of the causes of hypercalcemia. Now first we discuss the endocrine causes. So what would be your endocrine causes of hypercalcemia? Now endocrine causes could include, now since parathormone is secreted from the parathyroid gland, so it could include your primary hyperparathyroidism, right? Then it could be because of your thyroid toxicosis, and you can also see it in cases of pheochromocytoma. Then we have renal failure. Now, renal failure can be seen in cases of second or tertiary hyperparathyroidism, right? Then we have your malignant disease, which would include your multiple myeloma, right? Then it can include your lymphoma, and then your skeletal metastatic disease. Then we have some nutritional causes of hypercalcemia, which would include your excessive vitamin D ingestion. It could be due to vitamin A intoxication, and also because of a syndrome known as milk alkali syndrome. Then we have some granulomatous diseases, which would be your sarcoidosis, and one of the most common condition that you see in India is tuberculosis, right? And then there could be some of inherited disease like in hypercalcemic hypocalciuria, right? And then you have your immobilization, Paget's disease, and drug induced. Now in drug induced you have your lithium, right? So in inherited disease, sorry, I forgot to write it. It is hypercalciuric hypercalcemia. So these are few of your causes of your hypercalcemia. So again, summarizing the treatment, we would be causing increased excretion of the calcium, that could be via loop diuretics, reduce skeletal release in form of bisphosphonates, treatment of the underlying causes, where we have your endocrine causes, renal failure, malignant disease, nutritional causes, granulomatous causes and inherited disease, immobilization, Pegas disease and drug induced in form of lithium. Right, now in case of hypocalcemia, we use oral calcium and vitamin D supplements and 10 ml of 10% calcium gluconate along with supplemental magnesium. So these are few of your clinical scenarios that you would be getting in terms of hypo and hypercalcemia. And the last point which I would like to mention is regarding post-thyroidectomy. So what happens over here is chances of injury to parathyroid gland, now which can result in hypocalcemia in the post operative period. Right, so you will be getting all those clinical signs that we discussed in hypocalcemia, and this is one of the most common clinical scenarios that you would be coming across in your surgical wards. So this is in short regarding your calcium metabolism and some of the applied concepts when we would be discussing regarding the parathyroid gland disorders. So this calcium metabolism concept would come in very handy then. So that's all from calcium metabolism in this video. Thank you.